that was pretty radical, your statement about now we have soft plaque and what other kind of plaque? You've got to describe this. I didn't even know that existed.
Well, this is still, and again, everyone out there, I realize your head's spinning because I'm throwing things out you've never heard. I'm throwing things out your doctors don't know. But there is soft plaque is more dangerous than hard plaque because that's the plaque that ruptures under the influence of inflammation and causes you to have a clot, which causes the heart attack and stroke. So we need to be more wary of soft plaque, and this is what does not show up on our testing. So again, being told you have mild heart disease or mild blockage, or you had a past your stress test, or your calcium score is under 100, none of that should be reassuring to you because it isn't reassuring to me. This is what you need to do.
So what's the point of the test, though? I have to interrupt you here. They're talking a lot about the CT scan. What's the point of it if it doesn't identify what kind of plaque you've got?
Well, I do want to know if you make plaque. I
Okay.
want to know if you make hard plaque.
Okay.
So I'm categorizing people into they make hard plaque, do they make soft plaque, versus I don't make plaque at all because I don't want to give cholesterol drugs to someone who doesn't make plaque at all. So
Right.
there are people out there that are being overtreated just because they have high cholesterol and no one's looking for disease. And you have to look hard for disease.
So hold on a second. So you're telling me there are people out there who are on cholesterol lowering medication that shouldn't be on medication. They're just being put on medication and they haven't examined further whether or not they should be put on the medication?
Well, that's the country. That's where our system is. What's your blood pressure? What's your cholesterol? Do you smoke? Formula. Plug you into a formula. Hit enter, and do you get cholesterol meds? We need personalized care. You need to come to someone like me, who's going to first identify do you have disease or not, and then identify all your specific root causes of disease and treat them on a personal basis because everybody's different. Drugs are different and people are different, and you cannot make any kind of assumption at all based on anything that you think is true. So,
and that's one of the reasons why they need to go to a doctor that can spend more time with them.
And has the wherewithal to achieve this goal of preventing heart attack and stroke, and thereby other chronic illnesses, 100%. So that's what our goal is. So I want to get to the next point because it's very important.
What about this other test you were talking
Well,
about in the last segment?
that's
right?
what we're getting to. So we need to measure the wall of your artery because there's a layer of your artery that is at risk of growing and becoming inflamed. It's the layer of your artery that collects cholesterol, and that's where the plaque builds. Plaque does not sit on the inside of your artery wall. Plaque sits within the artery wall, and we can measure the layer of that wall getting thicker. We can measure something called plaque burden, and that is a measurable data point, along with the actual measurement of the wall, that identifies risk. And as we apply an optimal plan to you, we can see that wall get smaller and reduce your plaque burden and thereby reduce your risk of heart disease. And there's studies which we'll talk about more, but right now I want you to understand, that's Anne-Marie and everyone out there, that we need to start looking at something called a carotid intima media thickness test. And
that's way too complicated. That's
well,
way too highbrow.
Well,
okay, what is that?
It's an ultrasound of the wall of your artery. And for all the people out there that are just took a sigh of relief and said, oh, my doctor did a carotid Doppler and he said I'm fine, you're not listening to what I'm saying.
Is this another test altogether, a more specialized test?
A carotid Doppler is a blood flow test, and that's what you're getting everywhere. You need a carotid ultrasound of the wall of your artery, and that's basically what a CIMT is. It's an ultrasound measurement of the wall of your artery, and this directly looks at your risk for heart attack and stroke, because the more that's going on in that wall, the more your risk of disease is. And that's the data point we need to measure. Along with, there are some lab tests that measure inflammation indirectly, and we use those lab tests in conjunction with the measurement. Because lab tests don't always tell the story. You can't rely on them. And we already know you can't rely on the lab tests. We can't rely on your stress test. You can't rely on your heart catheterization.
But what can you rely on?
This, you need to look at the wall of your artery. You need to know if you make plaque. And then you've got to apply a program that allows you to be confident you're gonna reach a goal of not having a heart attack and stroke. And this is something that we do on a regular basis because we need time. That's the other thing, Emery. It's not just, oh, do this test and I'm done. We need time together, my patients and I, so that we can apply an optimal approach to individualize them. It just can't be done in the current health system where your doctor's seeing 30 people a day. This is not a 5-minute exam. We need time together every visit to review all your details. I mean, I had someone come in today for a sore throat. All right, we're done with your sore throat. Now come back to my office. Let's get on the big screen and let's go through all of your heart risk data again. Even though you're not here for it, let's spend 15 minutes re-educating you. Again, my patients all need re-education because this is new language for them too. Just like it's new language to all the listeners out there. We need to re-educate every visit so that we're on point and that we know where we are. Also, it gives me an opportunity to say, wait a minute, we're not where we need to be. I gotta dig deeper for you.
Right.
So we need personalized care, we need the right tools, and frankly, these tools are simple. This ultrasound is inexpensive, it's done in the office.
Okay, wait, I gotta ask you something about this. This test, is this a test that you can get? You said that there's no
You can't get it. You
Okay,
can't
well-
get it. You gotta call me. You gotta
Okay,
call. You
so-
gotta call my office, 248-737-0091. You gotta call to schedule the exam. I'm willing, because we're on the radio and I'm educating people, and I don't want to put people in a panic and go, "What do I do?" Because
Right.
I may not want to join your practice. What do I do? So I'm going to start offering CIMT ultrasounds in our office to anyone that wants to come in. Call the office, they'll put you on our schedule, we'll get the CIMT tests. I'll spend a few minutes with you when we get results back and get you on track. I mean, to be honest, the best thing to do is join the practice, especially if you have high risk disease when we look at you. But
Okay, let me ask you one question. At what age should people actually start looking into all this investigation and going into this type of practice where they build a relationship with the doctor to prevent disease?
I'm going to say 30 and over. 30 and over should be calling, especially if you've got a family history or other risk factors like smoking, high blood pressure, high cholesterol, stroke in the family, dementia in the family. Any of these are risks. And starting earlier is good. Don't wait too late.
So anyone with a family history or they think they might be at risk should definitely be calling you and getting these tests and this investigation. Well, we're out of time, and that wraps it up for the Kolender Medical Radio Show on News Talk 760 WJR, sponsored by Kolender Medical and Bystander Response. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Kolender for talking to us about taking charge of our health, being proactive, and avoiding both heart attack and stroke. For more information on Dr. Kolender's show and his office, call him at 248-737-0091. Again, that's 248-737-0091. We hope you enjoyed the show and that you've become more informed about avoiding heart attack, stroke, and the devastating results of artery disease. And more importantly, what can you do to halt or reverse the process? Once again, reach out to Dr. Kolender at 248-737-0091. Thank you for listening.